So I'm just going to give you a little summary of what our major learnings have been. Number one, ownership. You cannot do anything. You can send all the information, all the knowledge, wherever you want. But if the community, if the organization, if the individual does not relate to that, does not own that information, somehow bring their own information into it, it won't go anywhere but that one session. Secondly, that it has to be a comprehensive approach. We can't just drop information. We have to touch all factors and all audiences and all players and actors with this information. So we have to go policies, procedures, screenings, educations, evaluations. We have to do the whole thing to really make that knowledge work. Thirdly, you need systems in place. You know, we can go and give education in a country that about child abuse, about trafficking of kids, about what's happening with kids in kids who are working. But if there's no systems in place, you struggle on how to use informal systems versus formal systems. So when we say systems, we're saying both formal and informal, but you need to know the systems. And if there are no systems, then you need to start working at that level with the knowledge mobilization to start getting the systems in place, because we need those systems. When we look at education and knowledge mobilization, it needs to be for everyone. Every age group, both genders, we need to blanket around what does it mean to be safe. It needs to be adaptable. I'll talk to you about that. It only works if you build on partnerships, and that's what's so good about the CYCC network is we're building on partnerships. We can't get this done alone. The reason we've been successful in RespectED is because we built partnerships and partnerships nationally and internationally. Integration is critical. And I think integration goes back to the ownership one. Like, where are people right now? Where is the community right now? Where is that organization right now? How do we integrate that in? So I was working with people from Indonesia, and they were like pulling their hair out thinking, how do we do this? We've got so much to do. And I just said, no, stop. Look at the programs you're running right now. What are your programs right now? And how do you integrate it in? So when we look at nationally in the Canadian Red Cross with water safety first aid, it's how do we integrate violence prevention into water safety and first aid? How do we integrate it into home care? How do we integrate it into disasters? Just integrate it in. Evaluation is critical at every point, that we evaluate and that we know that we're doing is right, and there has to be some wins. People have to feel successful. They've got this knowledge, they've heard it, they've brought it together, and they need to have a win with it. They need to know, what can we do with this? What's our win? And what's our challenges? Well, sustainability is also always a challenge. It costs money. How do we sustain that? How do we sustain the going forward of this program? Capacity. How do we build capacity within organizations, within countries, within communities? And it's not only the capacity to develop programs, but it's also to deliver and monitor and support. Monitoring and support capacity is big. And how do we evaluate? We can evaluate at certain levels, but the big ones like the random controlled trials, all those are just really difficult and really expensive. And how do we do that? So those are our challenges. And I'll just leave you with what drives us. And this is what drives us forwards. Because we believe strongly that violence is predictable. And therefore, we believe it's preventable. And that this, now we know that this is not just words or an article of faith, but that it's a statement based on evidence. So that's our work. That's our challenge. Thank you.